from UP, there's a big controversy over the draft of the proposed Population Bill 2021. The UP State Law Commission in its draft is focused on 2 children and provided incentives to people who will be helping in population control. It says anyone having more than 2 children will be barred from applying to government jobs, and those who already are in government service will not get a promotion. The new draft bill also has barred people from contesting elections. The State Law Commission has uploaded its draft on the official website and sought public opinion by the 19th of July. This comes a day before UP Chief Minister Yogi Adityanath's announcement on the new population policy tomorrow on the occasion of World Population Day. Opposition, including the Congress, is fuming over the draft, calling it a poll gimmick.
ड्राफ्ट में ये व्यवस्था है कि पहली बात तो ये कि ये अधिनियम 1 साल के बाद लागू होगा। जो भी व्यक्ति जनसंख्या नीति का पालन करेगा उसको तमाम प्रकार की प्रोत्साहन दिए जाएंगे। अगर कोई सरकारी नौकरी में है तो उसको अतिरिक्त वेतन वृद्धि दी जाएगी। उसके पेंशन प्लान में सरकार का जो कंट्रीब्यूशन है वो 3% बढ़ेगा। इसके अलावा प्राधिकरण के मकान हैं, प्लॉट हैं, उनके आवंटन में वरीयता दी जाएगी। बच्चों की शिक्षा, चिकित्सा ये सब निःशुल्क होगा और भी बहुत सी सुविधाएं हैं जो हम इसमें देने जा रहे हैं।
उत्तर प्रदेश राष्ट्र का हिस्सा है और राष्ट्र का हिस्सा है तो जब राज्य में कुछ होता है तो देश की दृष्टि से भी फायदेमंद होता है और आगे दूसरे राज्य भी उस प्रकार के कार्य करते हैं जिससे कि जनसंख्या जो बढ़ती हुई जनसंख्या है उसको नियंत्रित किया जा सके।
एक मसौदा तैयार किया गया है और वो मसौदा चूंकि जनहित के लिए हम ला रहे हैं तो जनता से इस पर सुझाव भी मांगा गया है। वो मसौदा जनता के बीच में लेकर विधि आयोग उत्तर प्रदेश का जा रहा है। इस हमारी अच्छी पहल को जनता स्वीकार करेगी तो हम इस पर कानून जरूर लाएंगे, क्योंकि ये जनहित के लिए लाया जा रहा है, प्रदेश हित के लिए लाया जा रहा है, देश हित के लिए लाया जा रहा है।
जो जनसंख्या हमारा सबसे पुरजोर हथियार था, हम सबसे युवा राष्ट्र हैं दुनिया के, हमारे यहाँ सबसे ज्यादा वर्किंग क्लास पॉपुलेशन है। हमारे देश की जनसंख्या को देखकर यहाँ बड़े बड़े लोग निवेश करने को तैयार रहते हैं, कंजम्पशन यहाँ का बढ़ा है। अब वही जनसंख्या को आपने अभिशाप बना दिया है, क्योंकि आपने शिक्षा का बजट काटा है, आपने स्वास्थ्य का बजट कम कर दिया है, आपने इस जनसंख्या को अभिशाप इसलिए बना दिया क्योंकि इनके पास नौकरी नहीं है आज करने को। तो आपका जो कर्तव्य है शिक्षा, स्वास्थ्य, रोजगार देना, वो आप दे नहीं पा रहे हैं और उल्टे डिबेट को अब आप जनसंख्या के उस पर ले जा रहे हैं।
So let's take a look at the kind of benefits that's being extended to those people who then choose to have 2 children. Well, if you have 2 children, there will be 2 additional increments during your entire service. Apart from that, subsidy on purchase of a plot or a house that's going to be given to you by the government if you choose to keep your family size small, just to 2 children. There's also going to be a rebate on utility charges, something that's being extended by the government. Also, increase of 3% in EPF under NPS is what's going to be offered to you if you choose to have 2 children. Well, if you then choose to have more than 2 children, you're going to be at a disadvantage. It's clear. No promotion in government jobs. You can't be also applying for a government job. No benefits from government welfare schemes. You can't enjoy any of that. Ban on contesting elections. Also not eligible to get any sort of a government subsidy. So that is what the government is going to do if you choose to have more than 2 children. Benefits of having only 1 child. Let's take a look at what the government is going to offer to you. Free treatment for 20 years. Free education, insurance given to you by the government. Priority in admission. Also priority in jobs, especially government jobs, not the private sector. Of course, the government can't touch that. But in government jobs, you would be getting priority when it comes to having 1 child. That's what the state is going to do for you. All right, let's go to some breaking news just coming in. The National Women's Panel has asked the UP police now to take action against the assault on a woman during a UP local body polls. Remember that horrific video went viral. The woman proposer of an SP candidate was allegedly misbehaving in Lakhimpur Kheri. The National Commission for Women Chairperson Rekha Sharma has written now to the DG of Police in UP to immediately intervene in this matter and take strict action against the accused here. In question, looks like a couple of men. That video has gone viral of a woman's sari being pulled off, and that's the reason why the National Commission for Women has had to step in. It's become a big political issue also, with the opposition saying that this is indicative of the jungle raj that is in the state of Uttar Pradesh. Samarth Srivastav from Lucknow is with us for more on that story. Samarth, this horrific video has gone viral, and of course, rightly so, the opposition is asking questions about what really was happening. This is a setback. The National Commission for Women are demanding answers from the police.
Well, exactly. NCW had taken suo motu in the entire incident, and now Rekha, the chairperson of the NCW, has written to the Director General of Uttar Pradesh. So it is very clear, and after which, as per the NCW, after which the incident took place, the incident happened in which 6 cops, including circle officer and SHO, has been suspended. So this is big, as this is getting the UP politics is touching a new low with all these things happening. Akhilesh Yadav obviously tweeted and said that why are you doing all these things? You must not forget the lessons taken from the Ramayana and Mahabharata. This is what Akhilesh Yadav had tweeted. So all these things are happening, and also Ajay Kumar Lallu of Congress UP president had said that the entire panchayat polls of Uttar Pradesh must be stopped by now, and new dates should come in for the polls. So these are the allegations being put by the opposition, while BJP is kept on saying that yes, if the incident happened, then also the stern action was taken minutes or hours after the incident took place, as 6 cops were suspended. And obviously Akhilesh Yadav brought back the lady to Lucknow, where she spoke to media persons and said that his purse was also snatched, her mobile phone was also snatched, and it all happened. The misbehavior by some persons, unidentified persons, happened in presence of the cops. This was the major allegation, and a question on the question on the UP police machinery. As the DG Law and Order Prashant Kumar had earlier said that the cops are stationed in almost every district where polling is happening. Then why such incident took place? And not only about this particular woman which came to light, as it was recorded in the video. How many such incidents would have taken place in this entire scenario in 75 districts of Uttar Pradesh? As you see that in Sitapur, grenades were fired, in Lakhimpur this incident took place, in Mau some other incident took place. So this is something very scary. I must tell you that a total of 16 FIRs have been registered, and around 1800 persons were booked in this entire post-poll violence in Uttar Pradesh. 25 have been booked so far. So these are the things, some serious things, and this case of Lakhimpur Kheri especially raising some serious questions on the machinery of Uttar Pradesh government and also Uttar Pradesh police as well.
All right, thanks for getting us up to speed with that, Samarth from Lucknow, getting us all the details as far as the horrific video is concerned. The NCW now writing to the UP cops after the woman was found assaulted in Lakhimpur. Well, let's shift focus now to Kerala. Well, it was a virus that was first detected in 1947, seen in monkeys. But until 2007, very few cases of Zika in humans were reported. A major outbreak in Brazil in 2015 revealed it can lead to severe birth defects when pregnant women are infected. The first cases were seen in India in 2017. It has now resurfaced in Kerala. I filed this report earlier.
A new worry for Kerala. Already battling another surge in COVID cases, another virus has arrived to cause more alarm. So far, 15 people have been confirmed with Zika virus infections, setting off alarm bells in Delhi.
There are some Zika cases which have been reported from Kerala. To monitor the situation and to support state government in that endeavour, a 6-member senior team which consists of people from public health point of view, which also consists people from vector control, clinician from AIIMS. This team has already been issued instructions to reach there and support state government in terms of management of Zika there also.
A 24-year-old pregnant woman was the first to have been diagnosed with the mosquito-transmitted disease on Thursday.
ആശുപത്രിയുമായി ബന്ധപ്പെട്ട ചില ഹെൽത്ത് വർക്കേഴ്സിൽ ഇതുപോലെയുള്ള സമാനമായിട്ടുള്ള ഫീവറും റാഷസും ഒക്കെ കണ്ടത്. അങ്ങനെ 19 സാമ്പിളുകൾ പൂനെ NIVയിലേക്ക് അയച്ചിരുന്നു. ഇന്നലെ രാത്രിയോടുകൂടി നമുക്ക് സ്ഥിരീകരണം ലഭിച്ചത് അതിൽ 13 സാമ്പിൾസ് പോസിറ്റീവ് ആണ് എന്നുള്ളതാണ്.
So what exactly is Zika virus? The symptoms of Zika are similar to dengue-like fever, rashes and joint pain. The Zika virus is spread by an Aedes species mosquito. These mosquitoes, which bite during the day, also transmit dengue, chikungunya, and yellow fever. The Zika virus can be dangerous to pregnant women as it could lead to preterm birth and even miscarriage. This is because the virus can be transmitted from a pregnant woman to her fetus. It also causes birth defects in newborn children. The US Center for Disease Control and Prevention has found those infected with the Zika virus can also transmit the disease to their sexual partners. A mosquito-borne flavivirus, Zika, was first identified in Uganda in 1947 in monkeys. It was later identified in humans in 1952 in Uganda and Tanzania. Outbreaks of Zika were also reported in the America, Asia, and the Pacific.
The World Health Organization says that most patients suffering from Zika virus do not develop any symptoms. In fact, 1 in only 5 patients show symptoms of Zika virus. These symptoms last anywhere between 2 to 7 days. Also, unfortunately, there is no treatment available for Zika virus, and research on a vaccine against Zika virus is still underway. We still don't have a vaccine just yet for this infection. In New Delhi, Sneha Moldani for India Today. Health Minister from Kerala, Veena George, has said 14 cases of Zika virus have been reported in the state. She's added that Kerala has stepped up surveillance mechanisms, including vector control, to curb the outbreak. Listen in to this exclusive conversation.
We have another menace of Zika virus being reported in Kerala. So how is the state government and the health department viewing this crisis? What is the way forward in Zika management?
Right now we have 14 positive cases. The first case was that of a pregnant woman, and she's now absolutely fine, and she and her baby. And 19 samples were again sent to NIV Pune, and 13 samples were found positive. And after that we sent 14 samples, and all those 14 samples were negative. So we have developed an action plan, and we have the coordinated efforts of all LSDDs, the Trivandrum Corporation, and district administration and all other departments. We have intensified the vector control activities, and also we have, our department is on high alert, and we have asked all the medical officers to keep on surveillance among pregnant women, because also to do, if any pregnant woman has got fever or anything, she should be tested for Zika virus. So that's a message we have already given. Everything is under control, nothing to worry about, but we are on alert.
Well, with COVID-19 cases declining across the country, states have started to ease restrictions to resume economic activities, and people have started to flout COVID norms. You can see these frightening visuals of massive crowds of people from different cities on your screen. Such violations are not only happening in the hills, people in metropolitan cities are also disregarding COVID norms. Revelers are violating all protocol with no social distancing. Many can be seen without masks. It shows how Indians are failing to adhere to COVID safety protocol, endangering millions of lives. COVIDians are not only putting their own lives in peril, they often prove to be potential super spreaders. It's time for a quick break.